an annoying cat who I'll probably have to deal with, but we'll see how she does out there. Okay. Holiday recovery. That's what we've got today. Holiday recovery. We could also call it detox and digest. That's another one. We're going to do a lot of detox work, which is typically working on digestion, right? So after the holidays, our digestion can get kind of clogged up. And once that happens, there's sort of a trickle-down effect everywhere. And so we're going to do a lot of twists and a lot of work on the midsection, just for the detox benefits. But we'll also, I think, focus on a little bit more on shoulders and hips, just because these are the two areas that I think people have the most complaints about. So let's start, and we're going to start with some breath work. So you can start seated. Some people are just really uncomfortable seated. Sometimes when I start a class and I ask people to come to a comfortable seated position, it's the most difficult thing I've asked of anybody all day. You're welcome to do your breath work lying down, preferably with a pillow under your head but not under your shoulders, just supporting your neck so that your nose is like a ski slope going down, not with your chin up in the sky, because that's not so good on your neck. Or you can come to a seated position. Seated position, you can sit on a bolster or a pillow, preferably at the edge of it so that your pelvic bowl is tilted forward. You can also sit on your foam roller or sit on some blocks. And my ankles are one in front of the other. My ankles are not crossed. And we're just going to settle in, set an intention for the next hour, and work on our breath work. We're going to be utilizing two different kinds of breath work today. So let's close our eyes and think about just being comfortable in our position right here. And start to take some inhales through your nose and some exhales through your mouth. Nice relaxed jaw. Your time is limited here, Yoga. All right, let's bring our awareness to our spine. We want our ears to be over our shoulders, shoulders over hips. So you might want to tuck your chin and pull your head back into an imaginary wall. And then start to focus on your belly, rising with your inhale, filling up. Our breath fills up from the bottom of our lungs to the top, like filling up a glass of water. And then when we exhale, the air goes from the top of the glass to the bottom of the glass. And you draw your belly button in slightly at the bottom of your exhale. So first you feel your belly rise, then your low ribs slightly expand, and then your collarbone expands just a little bit at the top of your inhale. And then at your exhale, you just let your collarbone sort of just deflate. And then your ribs just gently pull in. And then your air comes out of the diaphragm, out of the area, the belly region. And let's even out the length of our inhales to the length of our exhales. Count for 4, in for 4, out for 4. So it's not a ujjayi breath that we're going to use today. It's not the breath that we employ in yoga. So when we're doing our foam rolling and our resistance stretching, our fascia flossing, this is the breath that we're going to use. Now let's start to lengthen our exhale. Inhale for 4. And let's exhale for 5. Now inhale for 4. And exhale for 6. Inhale for 4. Nice, big, deep belly, expanding your lungs, inhale. And you're going to exhale for 7. And finally, you're going to inhale for 4. And you're going to exhale for an 8 count. Relax your shoulders, pull the chin slightly pulled back. Everything is relaxed. And practice that double length exhale for a few more rounds of breathing. This is the breath work that we're going to use when we do our longer holds. Say goodbye. Goodbye, Yoda. In through the nose. So when we're in our long holds, which we're going to do at the end of class, this is the breath that we're going to employ. This down regulates the central nervous system. It lowers our blood pressure. It lowers our heart rate. It just gets everything relaxed. And we're going to want to be as deeply relaxed as possible when we get to the end session of our class. Okay, blink your eyes open. Let's begin with some foam rolling work. So we're going to start with on our back with our foam roller at the base of our skull. So it's touching the top of my back, not really my shoulders. I'm going to relax my shoulders down and keeping my chin slightly tucked and just rocking my head from side to side. And I'm kind of focusing on that occipital crest, that little knob that you'll feel to the right at the base of your skull and to the left at the base of your skull. Both of mine they almost feel like they're swollen, right? So that means there's a lot of tension here in this area. So I'm just going to sort of take it easy and rock from side to side, and I'll give you guys a couple things that you can do here. My chin is about 45 degrees over, maybe not even quite 45 degrees over to the right. So that the foam roller is on the base of my skull on the right side. I'm going to make some circles with my chin and my nose in one direction. And I'm going to make some circles with my chin and my nose in the other direction. What we're trying to do with the foam roller is we're trying to put gentle pressure on the superficial fascia, which is the connective tissue that's right below the skin, which is what a massage therapist would be, or your hand or your massage tool would basically be accessing. And we're just trying to move that tissue around and trying to hydrate the tissue. And I'm going to do this over on the left side. My left side's not as swollen or uncomfortable as my right side. So I'm going to go back over to my right side. So whenever we foam roll, we're being sensation detectives. We're looking for areas that don't feel quite right, and we're just going to think about going in there with the oil can and trying to lube it up, right? We're giving anything that's stuck in there, any stuck chemicals, an opportunity to release, and we want to get some fresh oxygenated blood in there. We can't change the length of the fascia. The fascia is so strong, we can't really move it, but we can try to make some chemical changes to it, which is going to feel good. Okay, so roll over onto your right side or your left side, doesn't make a difference. We're going to do what Sue Hitzman with the Melt Method calls the 5-minute facelift. We're going to sit on the side of our roller with the roller perpendicular on your mat. We're going to roll the corner of the jaw right below the ear. We're going to roll the cheekbone in line kind of with the ear. There's a cheekbone area here, and then we're going to roll on our temple. And so start with the lowest position. I don't want you to look down at your roller. I want you to kind of look straight over like you're looking through the sight of a gun. And I'm holding onto the roller with my top hand. And I'm making some little circles with my head. And I'm controlling how much pressure is on here. Now I'm going to pause, and I'm going to open and close my jaw. And I want you to move the roller around until you find that chewing muscle. Notice how it feels, because you're really going to compare it when you get to the other side. All right, now move the roller up to your cheekbone. You might be kind of jamming on your ear, and if your ear is tight and has some tight tissue on it, it might be uncomfortable on the ear, that's okay. I like to kind of rock back onto the ear and see if I can work some of the stiffness out of the cartilage and all the area in my ear. So I'm going to make some circles on my cheekbone. I open and close my jaw. Oh, I really feel it on this side. real slow. There's no rush. All right, I'm going to move the roller up to my temple. And I'm going to kind of rock forward and back. So chin down, chin up. I'm holding the roller in place. This feels really good. I'm making some circles with my nose. Find that breath count. In through the nose, out through the mouth. Even inhales, even exhales. Okay, let's go back down to the cheekbone. Make some circles. Open and close the jaw. I can't open my jaw very far on this side. And then go down to the jawline. It's that little area that kind of scoops up right underneath your ear. Pause. Open and close your jaw. A couple times. All right, and let's just rest. Come on your back. Come back to the position where the roller was under your neck. So for me, I feel like, and I think if you looked into the mirror, you would see this different. You would see this difference. I feel like my eyebrow is lifted. Everything is brighter in the right side. I feel my cheekbone is, my peripheral vision out of my right ear is just different than it is out of my left. The left side feels a little bit droopy and saggy. All right, let's go to the other side. Roller is perpendicular, you're on your side. Doesn't make a difference where your knees are or anything. I mean, it would be nice if your spine was stacked. Well, let's not make a federal case out of it. Okay, so we're going for that right below your earlobe, in from your earlobe where your jaw line, your skull kind of comes up. You can find that spot right there. Make some little circles. So I'm a right side chewer. So I'm probably not going to feel so much on this side, but it sure feels good. And my ear is very crabby on this side, so I'm going to rock on and off my ear. So I can get some blood flow in there, get anything that's stuck in there and come on out. I'm going to open and close my jaw slowly. And I'm making slight adjustments. Now move up to your cheekbone. I'm making slight adjustments, make some circles. I'm going to rest my head a little bit heavier. I noticed that I was pushing with my arm to not have so much pressure on here. I'm going to let this pressure go. I'm going to put all my weight on here because I can handle it on this side. I'm going to rock on and off my ear. I'm making slight adjustments when I open and close my jaw because I want to find that, what is it, the masseter muscle, whatever that muscle is there, the chewing muscle. I think it's really tight. Especially if you're a clencher, right? If you clench your teeth when you sleep, if you're a grinder, this is a really good thing to do. Okay, let's go up to the temple. So you wake up and your face is puffy, your eyes are puffy, you had a bad night's sleep, you had too many glasses of whatever. This is a really good way to detox and depuff the face. So I'm making some circles in my temple. I'm going to rock back and forth. Then I'm going to go back down to the jawline and make sure that we can get anything in there flushing out. It's an opportunity to get anything that we've released to flush down into our lymphatic system and release through the body, and I'm going back down to my jaw. Make some circles, open and close, and none of this is fast. All of this is slow. The whole day is slow. All right, and release. Come on your back. Rest on that little foam roller again. And now I feel like both of my eyes are lifted. Do you guys feel a difference? Yeah. I feel a huge difference. It's like the lights were turned on even brighter. Yeah. Yeah, it feels good. Super good for you. Okay, so now what we're going to do is we're going to work our way down shoulders, ribs, and into our digestive area, like around your waist. So you're going to still have your roller be perpendicular. You're going to come down onto your side and put the roller underneath your armpit. Now, if you don't have flexible shoulders, your elbow is going to be forward more, but if you can pull your elbow back so that it's in line with your shoulder, that would be a good thing. Now I want you to look down your body. I don't want your hips to be forward on your mat. I want you to scoot your hips back so where our spine is in line. We want to get our spine, good Lori, good adjustment. Hip, shoulder, elbow, right? Because we don't want to do this with our spine kind of crooked. So all I'm going to do is I'm going to rock forward and I'm going to find my pec muscle in the front of my chest here, and I'm going to rock back and get the back of my shoulder, kind of outer part of like where your lats are. Now when you roll back, you can lift your shoulder and look, lift your elbow up off the bed and look up towards the sky, or you can keep your elbow planted, and I'm just rocking back and forth. Big breaths. Remember, if we're flushing and we're finding anything that's stuck in this tissue, we want to breathe it out. We just want to envision a drain emptying. We want to envision an hourglass with the sand emptying. We're just looking to get rid and detox and flow, right? It feels good. All right, now you're going to move this down, and now I'm kind of boob aligned here, so I can't go too far forward, but I can definitely go back. We're going to come down the rib cage. I'm just doing little rocks forward and back. Then what I'm going to do is I'm going to angle the foam roller a little bit down towards my knees, because we're going to go down the rib cage, and our ribs are at a downward angle, right? So I'm going to do a couple passes here. We're getting into the, I'm forgetting what the word is, the little muscles that are in between your ribs. So come to me in a second. I'm going to do a couple passes, and I'm going to come down about an inch or two, and I'm going to go working down my rib cage. Oh, super tight. And I'm going to keep going down. You can roll onto your back if you want. You can release that top knee back, and you can kind of get in the back part of the rib cage. So what we're trying to do is we're trying to roll in the space in between the rib cage. You're going to obviously be on a rib, and you have to use your elbow to push. And I'm working my way down, all the way down to my bottom rib. That anatomy is escaping me. Okay, now I'm going to take the roller and I'm going to put it on my waist, right? I'm below the rib cage, and I'm on my waist. And I'm just going to roll forward, and I'm going to roll back. I'm using my bottom elbow to control how much pressure I'm putting here. All right, let's go to the other side. Oof. Yeah, that's good. That's what we're doing is we're driving blood flow, elbow in line with the shoulder, scoop the butt to the back of your mat. Roller is perpendicular. I've got my head in my hand, and I'm going to the front of my pec. I like to lift my elbow and kind of cruise around in the back of that shoulder blade area. That feels good to me. Inhale, exhale. Keep on going. Got a boat pulling in and next door, the bow thruster is really loud. All right, so we start underneath the armpit. We're thinking about a straight spine, because when we do this work, you want to try and be in alignment, right? Nice big breaths. All right, and then I'm going to come down a little bit, and I'm going to start working the space in between the ribs. The name is escaping me. Oh, don't forget to breathe. Slow it down. So you're just going to do a couple passes, and then you're going to go down a rib. And then you're going to do a couple passes, and then you're going to go down a rib. And then when I get too low, I'm lifting up. My head is no longer in my hand because I can't put this much pressure down here when I get low. And then I'm going to get it on my waist. And I'm going to go forward, and I'm going to go back. The nice thing, I'm going to scoot forward a little bit. When I go back, this is good because I'm getting my spine stabilizing muscle, basically getting your low back. That's gonna feel really good. This is gonna help with our digestive system. This is gonna help us detox from our holiday week of, it doesn't even have to be overindulgence. It can just be a change in schedule in a house full of company and maybe eating out more or just a change. So we're just gonna, we're just like pushing the reset button. Okay. All right, press yourself up. I could foam roll all day long. Let's set the foam roller off to the side. And we just were on our superficial fascia. Let's move on to the fascia flossing resistance stretching portion, which is where we're working towards the structural fascia. And this is, we've got certainly our upper body prepped, right? And our midsection prepped. And we're going to work on permanent changes in flexibility now. So let's start, since our shoulders are nice and warm, let's start in child's pose. Our knees are wide and our big toes touch. And we're going to bring our forearms like a number 11 with our palms facing down, right? We're going to do kind of a rocking child's pose. You can curl your toes under and stretch the plantar fascia and the bottoms of the feet if you want. If your toes are too tight and your ankles are too stiff, then you come to the tops of your feet. So we're going to engage the muscles in the top and in the back. So first let's do some cat-cow. First, just drop your belly, lift your chin, and arch your spine. Slightly look up. It's a little bit harder with the forearms down. And then push through your elbows, push through your hands, tuck your chin, and wrap your shoulders forward and dome your spine. And then inhale, drop your belly, stick your butt out, stick your tailbone out. Here's your inhale, here's your cow pose. And then exhale, the cat is in the other room with the paw coming underneath the door. Chin to the chest, wrap your shoulders forward. Okay, stay here, lift your chin away from your chest. This is what I want your upper body to feel like, this rounded upper spine. Now take your elbows, drag them down towards your knees, and then shift your hips back. Don't let your elbows move. Stretching the rib cage area and underneath the armpits and the back, and then come forward. So our starting position is shoulders over elbows. Push your elbows down, drag them, wrap your shoulders forward, and slowly shift back. So this can be, think about flossing. So think about the motion of flossing your teeth. You don't pull your floss through your teeth and then hold it in one position because it feels good, right? We're going to do the holding position later. Now walk your forearms over to the left, over to the right. My left forearm is on my mat, my right forearm is not. Most of the work is going to come out of the left. Press your left elbow down, start with your hips over your knees, and then shift your left hip back towards your left heel, and then come forward. So it's fluid. It's a fluid motion. We're going to do about 3 or 4 passes, and then we're going to move on to the next thing. Because I know this feels really good. Now go over to the left. You could stay here all day. You're going to do the same thing. You start with your hips over your knees. You start with your shoulders over your elbows. Push the right elbow down, drag it down, and pull back. Excellent. Okay, let's work on let's come down into the hips and the lower body. We can't really floss in a twist, but we can work all those supporting muscles. Let's come to gate pose. So your right knee is down, your left leg is out. And if you're tight here, if you have tight hamstrings or tight back or it's not comfortable, you can always put your hands on blocks. Okay? So the blocks are nice because the blocks bring the earth up closer to you. So you're going to extend your left leg long, and you can have your toes angled out, or you can harder to have your toes facing forward. So we're going to work the adductors, right? So the adductors are part of our liver channel, and our liver is in Qi and Chinese medicine, all part of our, and its main job is detoxing, right? So our inner thigh is part of that liver channel. So you're gonna take your left foot, you're gonna push it down, you're gonna drag it to the right until you feel your inner thigh light up. You can even take your hand and put it there and feel it. My right toes are curled under because I wanna stretch my plantar fascia. I'm gonna drag my foot to the right. I'm gonna bring my right hip to my right heel, and then I'm gonna come back up and start over. Push down, drag it, and come back. And remember, we're flossing. We're moving. You can angle your toes out to the side. You can lift your toes and drag your heel down. I feel it even more when I do this. My heel is very active. Here's my starting position. Push the heel down, drag it. You can bend the left knee. And remember, you don't engage in both directions. You come to your longest length of lengthening that muscle, and then you kind of let all that go, and then you come back up to your starting position. You just don't have to engage in both directions. The fascia doesn't respond. The fascia responds, the structural fascia responds in the combination of engaging and elongating. Okay, let's switch to the other side. Left knee is down, right leg is out. Play with the position, right? There's no perfect way to do this. I am much tighter on this side. I mean, I feel this right away. So I'm pushing my foot down, dragging it to the left, trying to engage my adductor, my inner thigh muscle here, and I'm just kind of thinking about that flossing, right? Forward and back. Engage and lengthen, and then let it go and start back up. You want to take breaks at any time. You can angle that right foot out. You can pick up your toes. I really feel it when I pick up my toes. Feels so good. Keep going, keep moving. So the engaged muscle tugs on the fascia, and when looked under a microscope, the fascia in the engaged and elongating position opens up and spreads. And so what we're just trying to do is we're just trying to hydrate this tissue, right? It's going to increase our lymph flow. It's going to unstuck any channels. It's going to give us greater range of motion. Okay, let's get off of our knees and come onto our back and work our hips. Now, I really like to do figure 4 2 ways because it gets the hips, but it also gets the low back. And I hear a lot of complaints, holidays or no holidays, I hear a lot of complaints about low back, tight low back to low back pain. Comes from a lot of different things. You guys know the drill. Come on your back, your feet are flat, your knees are bent. Bring your right ankle on top of your left knee. So low back pain can come from weak abdominals, it can come from an imbalance somewhere in the body, it can come from so many different things, right? Okay, interlace your hands, make a basket. Put that basket grip behind the right knee. Your left foot needs to stay on the mat on this one. So if you need to, take a block or 2 or 3 and put it underneath that left foot so that the left foot stays anchored, right? I don't need to do that because I'm flexible enough, but you might need to do that. All right, right ankle on the left knee, grip behind the right knee. So first we're gonna engage. All you have to do is press your knee into your hand. And once you've done that, I feel this whole engagement here in the outer part of my hip. I'm gonna bend my elbows, and I'm gonna elongate these outer hip muscles. And I feel it in my low back, and I'm gonna drag it over towards my left shoulder. And then I'm gonna come back up to the starting position. Starting position, your arms are long. Engage, kick the knee away, elongate, drag it over. So options here, you can bring your chin to your chest as you drag your knee across your body, and then put your head down, but you really don't need to. So the farther you bring your knee, the further you bring your knee, I think, and if you really relax through your right hip, you're gonna feel this all the way up into your low back. Okay, let's do the other side. Let's just go right to the other side. Left ankle, right knee, basket grip behind the left knee. So when I say to engage a muscle, I don't let you huffing and puffing and working so hard. Just kick the knee until you feel it in a muscle. That muscle is engaged. It doesn't have to be a lot. It just has to be a slight engagement. And then bend your elbows and bring it across. And I don't have nearly the range of motion on this side. I have a big difference. We're targeting the structural fascia. We can't change its length. We really can't do much of a change in there. All we're trying to do is hydrate it because we want our connective tissue to be hydrated so it can do its job. Its job is to support every muscle, every ligament, every organ, everything in our body so that it's working more efficiently. All right, let's take a break. So I'm gonna take a break in a rested bridge and a broken bridge. My feet are wide, I'm letting my knees fall together. And we're just gonna rest here and let that go. And hopefully what you're feeling is you're feeling some increased blood flow in that area. I don't feel it down the front of my body, but I feel it down the back of my body. It feels good. Let's go back to having the right ankle on the left knee. We're gonna do our figure four the second way. So this time, you're laying flat, your right ankle is on your left knee. You're gonna pick up your left foot, and you're gonna weave your right hand in between, and you're gonna interlace your hands behind your knee. Now I see a lot of people curl up like a little shrimp and bring their chin to their chest when they do figure four. I want you to relax your head, neck, and shoulders and just hang out here. Think about having a heavy pelvis. So to engage the back side and the outer part of the right hip, you're gonna kick your right ankle into your left knee, and then you're gonna bend your elbows, have a heavy hip, heavy pelvis, and bring this left knee in towards your chest, more towards the left side of your body, and then release. Mine isn't moving very far. Kick and pull, and then straighten your arms. Kick your ankle away. Here are some options. And one option is to kick your ankle away and bring your chin to your chest. And then release and start over. Another option is to kick away and drag diagonally. I'm bringing my chin to my left shoulder and bringing my ankle there over towards my right shoulder. And I'm keeping it fluid. All right, let's go to the other side. Right foot is down, left ankle, right knee. Weave the left hand through the gap, interlace your fingers, hamstring or behind the knee. Try not to roll to the left, okay? See if you can start with your knee and your ankle in line with this right shoulder and try to stay grounded on that right hip. Kick your left ankle away and then drag it in. It's not that, for me, it's not a lot of motion, not a huge range of motion. The hips are super tight. Kick away and then bring it in, and I'm going to do the variations. Don't forget to breathe. We're breathing into the nose. I'm going to do some cross body dragging. And release. All right, let's bring our feet mat's width. Let your knees fall in. Let your low back round arch. That's fine. And we're just going to rest here. And then drop both knees over to the right. So my left knee is not on the mat, but my right knee is flat. I'm gonna look down my body and I'm gonna move my hips over to the left because I want my left knee to be in line with my left hip, in line with my left shoulder. All right, now I'm going to start to pick up my left knee, but I'm gonna keep rolling onto my left foot, but I'm gonna keep my right knee down as long as I can. So we're kind of doing a supine 90-90. Then I'm gonna pick up my right knee and I'm gonna bring both knees over to the left. I'm gonna look down my body. When I start in my starting position, I'm gonna walk my right foot over to the right so that I've got more of a straight line here on the right side. I'm gonna pick up my right knee and I'm gonna start to open wide. Open, 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 open. Open as much as you can with the right side before the left knee comes over. All right, let's do one more time each side. I'm gonna start. I'm gonna bring my foot over a little bit to start. I'm picking up my left knee. Oh. And then my right knee is gonna follow. So we just warmed up that whole back of the hip. So this is a really good time to work on this mobility. Open, open, open. And come around. Good, hug both knees into the chest. You can take happy baby here. You can make some knee circles. You can rock from side to side. Put your feet down, knees are bent. Roll over to one side, press yourself up. Let's do a quick shoulder floss, and then we're gonna get into some long holds. So bring your left knee down, bring your right foot forward. If you have crabby knees, take your knee, put it on a bolster, or roll up your yoga mat, double it up, and put your knee down on it, okay? Shoulder, hip over knee, right knee forward, left elbow outside the right knee. We're going to target the back of the shoulder, and it's going to go down into this waist region that we were foam rolling earlier. Arm is straight, wrist is straight. I'm going to take my right hand and I'm going to bring it on top of my left wrist. My elbow's nice and high. I'm going to plug my left wrist to the left, and then watching with my eyes, I'm going to bring this stacked hand business here down towards my hip, and then I'm going to start over again. Good. Plug the wrist back. So the left hand is pulling to the left, the right hand is pulling to the right. Tug of war, 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 and you should feel it all back in through here. Take a nice big inhale to start. And come on down. Okay, let's go to the other side. You can also do this seated. I'll show it to you seated. I'll get to you kneel. I'll show you kneeling. Left foot forward, right knee down, right elbow outside the left knee, right? I'm bringing my arm nice and straight. I'm taking the left hand and I'm bringing it to my right wrist. I'm gonna plug my right wrist to the right, and I'm gonna pull with my left hand. We're getting the back of the shoulder here. It's gonna be good for your neck. So the more you aim down towards your heel, you're gonna feel more than if you bring it, and differently than if you bring your hand towards your rib cage. So notice the difference. Try to keep the knee over the ankle. Come on down. So to be seated, you would sit and do exactly the same thing. See if you can get your palm a little bit closer to your outer hip with each pass. And we're getting that spot under here, right? Exactly where we were on the foam roller. It's gonna help open up our shoulders. Good. And release. We're gonna go to our longer holds. We're gonna change our breath work to our doubling the length of our exhale. So actually let's do some mobility first. We did the supine 90-90. Let's try the seated 90-90 first, and let's just kind of see how we're feeling. So 90-90, I'm gonna sit, I'm gonna take my left shin and bring it on the mat in front of me. My left knee is in line with my left hip. Then I'm gonna bring my right knee, and I'm gonna bring my right knee in line with my right hip. So I see a 90-degree angle here, and I see a 90-degree angle here, okay? This might be enough mobility work for you. This is not a picnic, right? So sitting up as tall as I can, and I'll show you guys the difference. I'm gonna walk my left hand in so it's kind of closer underneath my shoulder so that I don't collapse. We wanna try not to collapse here. So any breath work you wanna do here is fine. I'm just going to lift my back knee and lower it. And lift my back knee and lower good. Try to sit up as tall as you can. That's a good range of motion there, Lori. I like that. Jennifer, I can't see your leg, but I'm sure it's moving. Okay. Now I'm going to take my right hand and I'm going to either bring my fist or my hand down onto the mat in front or below or behind my shin. And I'm going to pick my foot up. I'm in dorsiflexion. My toes are being pulled towards my knee. And I'm trying, I can do it down here, but it's a lot harder. I can even hold my left knee down. How you doing? Yeah, it's a little bit different, huh?
I'm just feeling it in my right hip.
You're gonna feel it in your right hip. If it locks up, stop, take your thumb, get some juice in there, get some blood flow going, work out that cramp, and it's tiny. For some people, all you have to do is think about lifting your ankle, because you can't, some people just can't get that mobility up, okay? Now, if that's not enough for you, and the other thing that you can do is you can take a block and you can put it under your left hand to keep yourself tall, okay? So make sure you're still in your 90-90. And what I'm gonna do is I'm gonna pick up my leg and I'm gonna go forward and I'm gonna saw it back. But I want my ankle to be in line with my knee. Okay, it's real easy to do with the ankle lower than the knee, and I'm just sawing forward and back. So we're strengthening and we're stretching your outer hip muscles. You feel that? Okay, put that down. Pound it out, and let's go to the other side. So my right shin is perpendicular. It's parallel with the front of the mat, right? So my shin bone right there is lined up. I'm going to scoop my butt over to the right. My left knee is in line with my left hip. My left ankle is in line with my left knee. So if it's really hard for you to do, you're going to have your heel closer to your glutes, right? And we're going to lift and we're going to lower. So you're using your right hand as a support. It's a lot easier to do this when you're down here. We want to try and maintain as high, as tall a spine as we can. And then we're going to go to the tougher part. I like to almost brace this front quad down, and I'm going to lift and lower my back ankle. We're using muscles that we don't use very often, right? These outer hip muscles. Okay, then you're gonna lift and you're gonna come forward and you're gonna come back. So Lori, a lot of the work that we do at our Monday sculpt session where we're working with the ball and we're doing our hydrants and all of that mat Pilates sort of work, that really helps with our hip flexibility. So you might find that you're good at this. Okay, excellent. All right, come on your back. Do you guys have a block or a ball or a towel or something? We're gonna do some T-spine rotation and then we're gonna go into our long holds. So your knees are bent, your feet are flat. You're gonna bring your arms out to the side and your arms are gonna be in line with your shoulders. And I'm holding a block, and realize that your block can be held in 3 different lengths, okay? Long, medium, and then where would be the short? Where would the medium be? No, you're not gonna be able to hold it. Medium, so either the short, I like the short, right? So what I'm gonna do is keeping my hips down, my block is in my right hand, keeping my hips down and my feet down, and straight arms. I'm gonna tick-tock the right arm up and over, heavy right hip. I'm gonna put the block in my left hand. I'm not bringing my left hand up off the floor. And then I'm coming back open. This is a thoracic spine rotation. Then I'm going to take the block in my left hand. I'm going to come all the way over. I'm going to put it in my right hand. I'm going to try not to pick my right hand up off the mat. And then I'm going to open. So come on up. Try to keep the hand flat so that you rotate the spine to get it over there. And then try and keep your head on the mat. I just lifted my head. My shoulders are, everything's tight. Come on over, come on over. I can do it much easier in this direction than the other. This is one of those things that would be really good just to do every day, especially if you tend to get the knot behind your shoulders. You can do it with a ball, you can do it with a towel, you can do it with nothing. Heavy hips, head is flat, and then slowly release. All right, we are going to start our our yin detox, our long hold detox. I've got 2 minutes in the timer. You're going to be on your back. We're going to do a wind remove into a twist. So you're going to hug your right knee into your chest. You're going to interlace your hands below your knee. Your elbows are going to be relaxed down by your sides. And you're going to be here for 2 minutes. So we're working our ascending colon. You're going to breathe in for 4 and you're going to exhale for 8, or you're going to go in for 3 and out for 6, or in for 2 and out, I don't care, out for 4. I want you to double the length of your exhale. You've got a tourniquet effect on your right hip in the front. Imagine that your body is in one long line. Pick up your head, tuck your chin, put your head back down. I want to get that ski slope nose action going on. I don't want you, if you have really tight shoulders or overdeveloped, really developed shoulders, you'll see this a lot with men. They'll lay down and their chin will be up to the sky because their muscles in their upper back push them up so much. In that case, you would put a pillow underneath the back of your skull where like a ball cap would go, not under your neck. You want to lift the back of the head. So this is a little bit active and it's passive at the same time because you have to hold your grip. This is really good for your grip in your fingers, really good for your knuckles. Your weight of your arms is pulling down. And with every breath, maybe that knee is getting a little bit closer to the right shoulder. And as you inhale and your belly expands, it's pushing onto your inner thigh, maybe. All right, we're going to go right from here to the twist. Take your left hand, bring it to your right knee, and bring that knee over towards the mat on the left. I'd like for your shoulder to stay down on the right side so that we can take this a little bit more out of the shoulder and really think about this being a twist through the spine and a twist on the right side, right? On that right side of our digestion there. I'm holding my knee with my left hand. You can look to the left. If you have a bolster or a block nearby, you can rest that right knee on a bolster or a block. But you don't need to. I just want you to see if you can just relax here. You're going to feel this in your low back. I'm going to come scoot over here and grab my block and rest it down. So you're stretching your shoulder. I feel a stretch in my glute. Relax your glute. Relax your low back. Lengthen that exhale. Relaxed muscles stretch better than engaged and tight muscles. So the work we were just doing before, where we were engaging the muscle, we were targeting the structural fascia, We were not working on a huge range of motion with a muscle. We were stretching our muscle, right? But not this way. This is totally different. This is muscle. You might be starting to feel a change, maybe a loosening. All right, release, just come on your back. Bump your hips a little bit to the left and extend your right leg and extend your left leg and just let that go. Head is relaxed. Ground down through your right heel and imagine that your right leg is real long, in line with your hip, in line with your shoulder. And now bend your left knee, interlace hands on top of your left shin. Wind removing pose on the left. If you want to go out and around the rib cage and then back in towards the shoulder, you might get a little bit more range of motion here. Let's change the grip and put the other thumb on top. It'll feel weird. You've got 2 minutes here. You need to think about relaxing your glutes and relaxing your hip flexors and relaxing pretty much everything. The work is the grip to the leg. And your belly is rising, right? You feel the diaphragm and you feel the whole body expand. Your back expands into the mat, your ribs expand out, maybe into your elbows. Your belly expands into the thigh. This is our descending colon on this side. With every lengthened exhale, that knee comes a little closer to the body, to the shoulder, to the chest. And your left hip is so heavy. Focus on your breath. It'll help you to relax. Your relaxed breath translates to relaxed muscles, which translates to greater range of motion, increased flexibility. We want our muscles to be comfortable at a different range. So we're turning off all the signals. Twist, right hand, left knee. I'm gonna bump my hips a little bit to the left, and then I'm gonna bring that knee over to the right. We've got 2 minutes here. You can hook your toes behind your knee. You can extend that top leg out. You can extend both legs, whatever feels good here. Now, I'd like you to keep your left shoulder down. Look over your left shoulder. That's going to bring the weight of your head over and help you stay grounded there through the left shoulder. I need some support on this side, so I went and got my bolster so that I could rest my leg down. You don't have to be supported here with props, but you'll be a lot more comfortable if you do. If you take a traditional yin class, there are no supports. There's no blocks, there's no bolsters. That's like hardcore yin. What we're doing is restorative. Restorative encourages props. You want to take the work out. You want to bring the breath front and center. We want to do everything we can to be as relaxed in your stretch as possible. for our holiday reset. Sometimes we're more active over the holidays, and that can give us tight hips, tight muscles, tight shoulders, stiff back, whatever. And sometimes we're a little bit more sedentary. We might have a house full of company and we're doing dishes, or, all right, come on your back, extend your legs out long, or hug your knees into your chest, whatever feels good here. This is your transition. It's just a break, it's just usually a break in your schedule that causes people to, after the holidays, to feel like, oh my gosh, like I really gotta get back into it, or I've gotta make this change, or I've gotta make that change. So we're just acknowledging all of that right now. All right, let's go into a supported bridge. So your feet are down, your knees are bent, you're on your back. You're gonna take your block and or your bolster, you're gonna lift your hips, and you're gonna put the block not under your low back that arches, that's your lumbar spine, you're not gonna go there. You're gonna put your block or your bolster, and remember your block has 3 heights. I think I'm gonna go middle height. And I'm just gonna rest the back of my pelvis. Yeah, that's the height for me. Okay, I'm gonna walk my shoulder blades together. I'm gonna keep my chin tucked. And I'm looking down my body. If I'm gonna sit here for a long period of time, I wanna make sure that my spine is in line. So I want my chin in the center of my chest, and I want my knees to be tracking here with my hips. If you do palms face up and put your shoulders into a little bit of external rotation, it helps keep your chest open. So we've got some options here. You can change out the level of your hips. You can extend maybe one leg long. See what that feels like? As long as you don't start arching your lumbar spine or your low back, or you can extend both legs out long. That's a little bit too much pressure for me on my low back with my block at mid-height. If I went to my lower block or to a bolster, I would much more easily, so I have my block on my tailbone and the back of my pelvis, yeah. At the low block height, I am comfortable with my legs long. I don't feel anything in my low back. You should not feel anything in your low back. If you do, then you need to lower your support under your hips or bend your knees. The other thing that you can do is have your feet wide and let your knees fall in. This is broken bridge. I like to energetically let my knees just fall inward. They're not touching because I've walked my feet out a little bit wider. Because then that way I don't have to hold on to them and have my knees not flare and fall out to the side. You can definitely use this yoga strap here. This is a very gentle, passive, low back stretch. Give me 3 good breaths with your nice long exhale. Lift your hips, release your block or your bolster, set your hips back down, and gently hug your knees into your chest. You can hold behind your hamstrings. You can hold on top of your shins. I like to put my right hand on my right knee and my left hand on my left knee and just flop out here. It's a little bit of a counter pose. You can bring your chin to your chest, bring your chin to your knees, and get a little bit of rounding in your spine, counterpose to what we just did in the opposite direction when we were stretching out our hip flexors, and our low back and our lumbar spine was in a little bit of a counter position to this. All right, bring your feet down. Roll your knees over to one side and slowly press yourself up. And that was our holiday reset for today. Thank you guys.